All right. I've been wanting to talk about the spiritual side of physical therapy for a long time, but I've hesitated because I know a lot of people that follow me don't share my faith, and that is okay. But God's been nudging me to talk about this for some reason, so I'm just listening and going to take this for a ride. So buckle up because I don't know exactly where it's going to go, but the spiritual side of physical therapy is tied to the holistic model of healing, mind, body, and spirit. And a lot of people can understand the mind and the body part quite well. It's pretty easy to understand that. But the spirit is often overlooked because it's very individual for a lot of people. It's kind of an out there topic, and I totally understand that. But to me, to simplify it, it's connecting to something bigger than yourself. And in the context of an injury or a sickness or an illness, whatever, like it's a reminder that what you're going through at that time might have a purpose. It might be teaching you something. It might be preparing you for something. And in the moment of going through that injury, that's the last thing you want to be thinking about. Like, I don't care that it's preparing me for something. I just want to get better. And that is fair. And that's how I've gone about my injuries. I've had those times of just frustration and like, why am I going through this? But when you can connect to something, for me, that's God. When I can pray and ask God, just help me understand, why am I going through this? What are you trying to teach me? It can shift something in your mindset. And that's really, really important when you're going through a tough time like that. So I think it's an important thing to talk about with yourself and with your doctor if you feel comfortable doing that. And it's something that I think can start to trickle its way into the medical profession in the appropriate times. It's not appropriate all the time. I understand that, but I've noticed a difference in how I go about my own injuries, and I've noticed how it can be really powerful for other patients. So that's all I'm trying to get out there. The fact that I think there's something to connecting to that part of yourself when you're going through an injury or a sickness. And I'm just going to leave it at that. Let that sink in for a little bit. All right. You can take your seatbelts off. We're off the ride.